Welcome to my podcast. Today I'm going to talk about another common case being faced lately and recently, and it's on the rise. So basically, you have to introduce yourself, as we always agreed, double check the patient date of birth and the name. You'll ask the patient, how can I help you? So the patient might say that, doctor, I'm feeling unwell. I'm feeling fatigue, I'm feeling not myself, and I'm trying to lose weight, I'm not able to lose, and I just want to double check what's going on with me, and thus I'm coming to you. So you'll ask the patient if there any thought or any concern that's bothering you, and why you are just now being bothered. Can you tell me more about it? The patient might say, doctor, I'm being obese, I'm being overweight, I don't like my body, I don't like myself, I feel I'm very slow in everything, I'm feeling that I can't cope, I can't do anything, so I'm short of breath, and I just want to know what's going on. So I'll ask the patient, do you have any past medical history that I should know of? If there is any family history of the same thing, if it's something run in the family, and have you done any blood investigation before? The patient might say, I've done before, and I've been told that I'm having a fatty liver. So you'll try to explore what's the reason for that. You'll ask if the patient is a drinker, and if the patient eating unhealthy, for instance, what sort of lifestyle does the patient has, what sort of work do they do, is there any activity in their life included, and then you will explore all of that, and if there is any medication being taken, if there is any other associated illness, or if there is any diabetes mellitus, or raised blood pressure, or if there is any history of thyroid problem, and you will just explore about that area, and if there is any medication wise that the patient is taken on a regular basis. So the fatty liver is being given a term called non-alcoholic fatty liver disease, which is NAFLD, which has been seen in a patient who's drink little to no alcohol, but they were, on the other side, overweight and obese. It's been stated that recently it's increasing, and it's on the rise worldwide, and it's common encounter that could lead later on to liver scarring, liver disease, and which is the same damage being caused by heavy alcohol intake, more or less. And it's given a name recently which called MASLD, which is denote metabolic dysfunction association steatotic liver disease. So basically the patient in those kind of scenario, they usually have no symptom at all, or they could have some sort of fatigue, short of breath. They could have abdominal or tummy pain or abdominal discomfort. They might have abdominal swelling as well. Maybe they have shortness of breath, so they are dyspneic all the time if they do any minimal exertion. They might have leg swelling and further stages. They might have red palm. They might have itchy skin. They might have yellow skin and sclera, which is basically jaundice. They might have spider-like blood vessel, which is a mated one in the skin, or enlarged spleen. In this kind of patient, you try to look for the risk factor. So you need to ask, as I say early on, if there's any family history with the same thing, if there is any history of raised blood cholesterol or triglyceride, or if it's run in the family, if there is history in females, polycystic ovarian syndrome, if the patient has history of obesity long-term, and if it's run in the family, if the patient is snoring or having any obstructive sleep apnea, if they have thyroid, and I mean by that hypothyroid, and if there is any history of diabetes mellitus or raised blood pressure and they're taking some medication for that. So when you ask it and explore about all of that, you will tell the patient if there is any worries or any concern, and if the patient has any blood investigation being done before. And you will ask the patient, I would like to have a quick look and examine you with a chaperone if you are happy to do so. And then you will arrange, after you agreed with the patient, certain blood investigation. And in those sort of cases, you need to send for the standard screening. And I mean by that the viral screen, which is hepatitis B and C. You could include HIV as well. And you will send for the ferritin, transferritin saturation level, and the autoantibody, which including the mitochondrial and those kind of autoimmune diseases, and the hemoglobin A1C, and the liver enzyme, which is AST and ALT. And I just found out that there's a link, which is a very good one, which just measure for you instantaneously. It's not like something that you need to memorize. It's basically for the drink, the type of the drink they drink, which is cider, alcohol, wine, spirit, gin, all sorts of thingy. You just put the thing, put the cup that they drink, and it will estimate the unit, because you need to explain to the patient if they are alcoholic or they drink alcohol drinker, that not to exceed 14 units, as the government announced, per week. And the website is www.drinkaware.co.uk, which is a very good one. So you can put that as a note for you. And then you will try to explain to the patient what measures can be done. So you'll arrange with the patient and talk about the management after agreed with the patient. So you will tell them you need to try to keep healthy weight. So if you are overweight or obese, try to lose at least 10% of your current body weight. Try to eat healthy, and I mean by that vegetable, fruits, this one, avoid any, you can, of course, include lentil, those kind of things which without fat or meat, because certain people, they say, oh, I need to cook with meat every day, which is unhealthy at all. Also, limit alcohol and the sugary things, and always invest in a portion size. So it means you need to eat a small portion rather than a big one, and try to exercise, be active most of the day of the week. It's not only about, 2 days I'm gonna walk and the rest of the day I'm sitting. It's not like this. Try to invest to be active most of the days of the week in order just to keep moving and try to lose some weight. So I hope by that I have covered one of the most important topics that is on the rise, as I say, which is a common form of chronic liver disease and can lead to, of course, to hepatitis. And it's a serious fatty liver disease, which is called non-alcoholic steatohepatitis. And that's kind of condition where the fat will deposit in the liver, and the liver will swollen up, and this will be damaged by the fat deposit, which leading to scarring and cirrhosis at further stages. So by that, you have to explain to the patient thoroughly what's non-alcoholic fatty liver disease, because it's a common thing and can be seen also by the by the ultrasound, abdominal ultrasound, whereby the liver will look faint and low echogenicity, and it's important to tell the patient that part of the management or part of the control is to lose weight and to stay active and eat healthy. Thank you.